Thanks, Jessica Hopkins, Public Health Ontario. I was just wondering, so in the event there is a positive from milk, do we have a plan to start active surveillance in humans? I think that, I'm just sort of thinking about like, what's the next step? Are we just going to wait, or do we have something that's kind of queued up and ready to go once we see a positive? Thanks.
So, Jessica, that's exactly the protocol I was talking about in the enhanced surveillance that we're working to put together that we won't use. I shouldn't say we won't use. There's some potential ways we could use it. We could get baseline. We could do it on pigs. We could do it on avian, even though it's been done by the BC folks. So, but obviously the preoccupation is to land something so that if we do find a positive farm, we can get in there. But that's where our work right now has been focused on, trying to develop something that would be implementable around those farms. I will flag that, there's the science part and the lab part and the thinking through the epi part. And then there's the enormous sensitivities around who's going on farms, are these quarantined areas, the farmers, the undocumented workers or migrant workers, documented, like that whole sensitivity area about we are here from the government and we're here to help you testing that has been very challenging.
On the Health Watch tonight, we are learning about the first human death from bird flu in the U.S.
The 65-year-old man from Louisiana was hospitalized with bird flu after getting exposed to it by wild birds.
Our Charlie DeMar spoke with a local expert about their concerns and also how concerned we should be.
And Joe Necker, as you mentioned, the first death here in the United States, but it is important to note that so far there has been no person-to-person transmission of bird flu, and that gives the CDC reason to believe that the health risk to the general public remains low, at least at this point.
Thumper, a 10-year-old Eurasian lynx, is one of 20 cats to be infected and die from a bird flu outbreak at an animal sanctuary in Washington state.
For whatever reason, cats seem especially susceptible.
Lincoln Park Zoo's director of the Urban Wildlife Institute says his staff is closely watching its bird and big cat populations for avian flu.
They are very susceptible, and there is a possibility that birds could get into those enclosures, something like a pigeon, a seagull, a starling. So absolutely, there's a real need to watch there too.
The first human in the United States has died from the bird flu. The Louisiana man was over 65 years old, had underlying medical conditions, and was exposed to a backyard flock and wild birds.
Bird flu is transmitted through the migratory bird population. It's spread through the bird's saliva, the feces, the urine.
If you have cats that you let outside, it's a good idea to keep them inside. And certainly if you let them outside and they bring in a dead bird, not only should you not touch that, but you might want to have your cat checked out. I do worry, is there a pathway there that could lead to more pet fatalities or even, worst case scenario, human infections?
According to the CDC, at least 66 people have been infected with bird flu since last year. Most have had direct contact with sick birds.
And another piece of advice shared by the Lincoln Park Zoo is to take down your bird feeders during this bird flu outbreak, because that, of course, is a place where birds congregate and disease can easily be transmitted.
In other jurisdictions who've attempted to do this.